Good morning, sir.
Good morning. Good morning, Dipon. Today we are going to share a few facts and figures about intraocular lenses. What are intraocular lenses? How are they used in cataract surgery? Is what we are going to talk about. Well, let's go back and understand what cataract is. So, cataract is cloudiness of the God given crystalline lens. This can happen because of trauma, because of aging, and because of other diseases that might be associated. So, when the cataract appears, meaning the crystalline lens, the God given lens, turns cloudy, then we have to do a cataract surgery, and during the cataract surgery, we have to replace this cloudy lens by a intraocular lens which is crystal clear, and this restores the good vision of a patient.
Sir, what is intraocular lens?
An intraocular lens is a clear lens which is placed inside the eye of a patient who is undergoing cataract surgery.
What are the main types of IOL?
Well, Dipon, the main types of intraocular lenses which are placed in the eye during the cataract surgery are a monofocal lens, a particular lens called advanced monofocal lens. Another lens which is also there for use is called the extended depth of vision lens, and yet there is the lens which is called the trifocal lens, which can all be placed in the cataractous eye after the cataract is extracted, and it is placed during the cataract surgery.
Sir, where is the IOL placed?
The intraocular lens that is placed inside the eye is in the place of the cataract lens which has been removed. Wherever the cataract lens was placed by God during the creation of the eye, that is exactly where the intraocular lens is placed.
Sir, what are the steps before implanting IOLs?
Well, the steps that are most important before implanting the intraocular lens goes into a huge number of calculations by machines that have been developed over the years, and this is what gives the high precision, accuracy, as well as the excellent vision after the intraocular lens has been placed in the cataract surgery. So there are equipment called the biometer, there is the assessment of the anterior segment of the eye and also the posterior segment of the eye, and also the potential of vision that is expected after the cataract surgery. All these assessments are made before the intraocular lens is placed inside the eye.
What are the benefits of monofocal IOL?
Well, the benefits of the monofocal IOL is huge. These were the first intraocular lenses that were developed from the time immemorial, and they have stood the test of time. They give excellent distance vision, but a near vision glass or an intermediate vision glass has to be worn for a patient who undergoes an intraocular lens implantation with a monofocal IOL. Well, the advanced monofocal IOL is an advancement of the technology of the intraocular lens, which is the monofocal intraocular lens. It gives an added advantage of viewing a little bit of the intermediate vision, where it actually retains the distinct and clarity of the distance vision, meaning an advanced monofocal IOL patient sees very well for the distance and also sees the intermediate distance to an extent, and the clarity is excellent.
Sir, what are the benefits of EDOF IOL?
The extended depth of focus intraocular lens is the EDOF lens, and this is a great advancement over the intraocular lenses of yesterdays. And it gives a great advantage of excellent clarity of vision for the distance. It also gives a very good clarity for the mid distance where we use the computer or while driving the dashboard vision. All this becomes very clear. However, if someone has to read very near objects, a thin pair of glasses would have to be used. But the crystal clarity of the viewing of a distance object as well as an intermediate object without glasses after a cataract surgery is what EDOF IOL stands for.
Sir, what is a toric IOL?
Well, the toric IOL is an excellent concept, and this is a premium IOL that has been developed over a lot of research. Now, if we look at how the intraocular lens works, there is a spherical component, and at times the doctor says you have a cylinder power as well. So after the cataract surgery, to attain a very good vision for the distance, middle and near, there can be an assessment. If the cylinder power is high, then a special type of lens called the toric intraocular lens is placed inside the eye. So what are the benefits of the toric intraocular lens? The benefit of this particular lens is that it gives very good distance vision for a patient who has both spherical as well as cylindrical power. So both the spherical component as well as the cylindrical component is incorporated into the intraocular lens, and thereby after cataract surgery the patient can see very well without glasses. And if he has chosen an intraocular lens that is a trifocal lens, then he can see very well for the distance, middle and near. If a patient with a cylinder has chosen an EDOF lens, then also an EDOF toric gives this patient a very good distance clarity vision as well as middle vision. And if the patient has chosen a monofocal toric lens, then that patient with the cylinder power after the cataract surgery will enjoy the distance vision very nice and clear.
Sir, what is the trifocal IOL?
Well, Dipan, a trifocal IOL is an excellent intraocular lens that has been developed over many years now. And the technology is a very mature technology which gives the patient after the cataract surgery excellent distance vision, clear without glasses. The patient can see also the middle without glasses and also the near vision without glasses. So the distance, middle and near, everything can be seen without glasses if the patient has gone in for a trifocal intraocular lens. However, we just need to see which lens is applicable for which patient. So it is not necessary that a trifocal will give excellent benefits to every patient. It is not necessary that the EDOF lens will give excellent benefits to the lifestyle of every patient. A monofocal lens also has its own importance. So the doctor is the best person to advise which intraocular lens should be used during the cataract surgery, and that discussion should take place between the doctor and the patient, and the needs of the patient is what we surgeons keep in mind when we are choosing or advising an intraocular lens for a patient.